So I think Tadalafil, I think, is actually a really, really good medication. I think for guys who are experiencing any erectile dysfunction, for guys who have any cardiovascular disease as well, this is a really great medication. I also urge caution with just treating erectile dysfunction with Tadalafil, because I always talk about the sort of the holy triumvirate when it comes to erectile function, and just thinking about essentially brain and nerve issues. So are you stressed? Do you have any nerve problems? And those are really things to sort of consider. Then obviously hormonal problems, which obviously we'd be trying to treat as well. And then vascular issues. Is there a problem from a vascular supply? Do you have vascular inflammation or atherosclerotic disease as well? And making sure you consider all of them and sort of ask the questions, because if one of those or more than one of those has a problem, then you won't necessarily be able to wholly treat it with a PDE5 inhibitor. But I think the benefit, so some people struggle with some side effects from Tadalafil, and they can range from reflux, so acid heartburn. So, you can bypass for that by taking it after food and things like that. Sometimes people get a bit of a stuffy nose because they're causing dilatation throughout the body as well. So that's just something else to look out for. And actually for those people, just taking a really tiny dose of half a tablet a day can sometimes resolve those things. The other issue that some people get, particularly if they do a lot of training and a lot of deadlifting and things, can be back bump as well, which is just something else that's just pretty unpleasant if you don't warn people off about. And again, for me, I'll often say to people, actually start off on half a tablet, see how you get on with it, see if you get any side effects, and go from there. But yeah, Tadalafil is definitely a medication that I would recommend. If any of those things are an issue for you.